So I did bands and orchestras, elementary school, middle school, high school, college. Clarinet's my best instrument. I made it to Pennsylvania All-State Band a couple of times. And then my senior year was, I made it to All-East Band, which was, you know, people from up and down the East Coast basically. And I had a lot of fun in that. In college, we got to team up with the Altoona Symphony Orchestra, which is kind of like the BSO, just for the Altoona. But I got to play clarinet in that. We played The Planets by Gustav Holst, which is a great, just long, epic piece of music. And it worked out, so I was the third clarinet, but I had my own part. It was me, the second, the first clarinet. And so I essentially got to be in a professional orchestra, which to this day is one of the best experiences I've ever had. It was so much fun. I really enjoyed that. I'm a clinical research associate at the Cancer Center here. I've been here, it'll be 3 years in October at the Cancer Center here. Been at GBMC for 5. Like so many people, I started off thinking I might be a doctor. I went to college, I majored in biology, so I started off in trauma research, found my way here, and then a position opened up here. So my main job is to provide support to our physicians and our clinical research nurses in identifying patients that fit criteria for certain clinical trials, then helping them to enroll or sign up basically. And then after that, really the meat of my job is to extract clinical data from the patient's chart and then enter it into these large databases, which is where the study sponsors are able to glean information about a certain drug that they're trying to get approved, or a different indication, meaning using it in a different disease type. So really I view my job as taking the patient care narrative, which is this complex story basically, and distilling it down into discrete data points that can then be quantified and analyzed. And that's how we get things like side effects. And if you watch commercials and all the listed side effects, they come from clinical trials and people's experience with them.